I welcome you all to the second part of our video, which is the important short answers of upper limb. So I hope you all loved the previous video. So let's start with this session today. So this is the second part of our important short answers and repeatedly asked short answers, which is asked in the university exams. Okay. So the first question is the nerves closely related to humerus. So what are the nerves closely related to humerus? The first one here. For this question, diagram is the most important one. So if you draw this diagram and if you mark all these nerves here, you're going to get the whole 2 marks. Okay, so here the first one is the axillary nerve, which is around the surgical neck of humerus. So this is a surgical neck of humerus and the axillary nerve is wrapped around the surgical neck of humerus. Okay, the second one is the radial nerve and it is the radial groove. So this radial groove is in the posterior lateral surface and the radial nerve rests in the radial groove. Okay, and the third nerve is the ulnar nerve, which is behind the medial epicondyle. So this is the medial epicondyle and the ulnar nerve is behind the medial epicondyle. So for this question, diagram is very important. Please the next question is the branches of the brachial plexus. So for this diagram also, the diagram is very important. How many pages you write, they will not see anything. Okay, if you draw this diagram and if you explain this diagram, you are going to get the whole 2 marks for the short answers. Okay, so this diagram is important. Please be careful. I'm going to explain this diagram. Take a note, take a look on this. Okay, so first here the brachial plexus is formed by the roots C5 to T1. Okay, the C5 to T1 form the roots of the brachial plexus. Okay, then the trunks. So the C5 and C6 form the superior trunk, the C7 form the middle trunk, and C8 and T1 form the inferior trunk. Okay, so the superior trunk is formed by C5 and C6, the middle trunk is formed by the C7, and the inferior trunk is formed by C8 and T1. Now, the superior trunk is divided into anterior and posterior division. The middle trunk is divided into anterior and posterior division. So this red denotes the anterior division and blue denotes the posterior division. Okay, so superior trunk is also divided anterior posterior. Medial trunk is divided into anterior posterior and the inferior trunk is also divided into anterior posterior divisions. Okay, now on to the chords. So the lateral cord. Okay, the lateral cord is formed by the anterior division of the superior trunk and the anterior division of the middle trunk. Okay, now this is the lateral cord. Now this lateral cord is formed by anterior division of superior trunk and it is formed by anterior division of middle trunk. Okay, okay, now posterior. Now posterior cord is formed by the posterior division of all three trunks. Okay, look carefully, look at the diagram. The posterior cord is formed by posterior division of all three trunks. Okay, now medial cord. So the medial cord is formed by the anterior division of inferior trunk. Okay, so the medial cord is formed by anterior division of inferior trunk. Now on to the branches. Okay, so here the musculocutaneous nerve is derived from the lateral cord. So this is the musculocutaneous nerve. See, it is derived from the lateral cord. Okay, it is derived from the lateral cord. Then on to the axillary nerve. Axillary nerve is derived from the posterior cord. So this is axillary nerve. It is derived from the posterior cord. Okay, then on to the median nerve. See, for median nerve, it is divided. Median nerve is coming from two cords, which is the lateral cord and medial cord. So median nerve is derived from lateral cords and medial cords. Then the radial nerve. So here the radial nerve is derived from the posterior cord. Can you see here in this diagram? The radial nerve is derived from the posterior cord. Ulnar nerve. Ulnar nerve is derived from the medial cord. Okay, so it is a very easy diagram. I searched so many times and I came across this diagram, so I found it very useful for myself also. So I have uploaded here. So please take a screenshot of this diagram, draw this diagram as how, once you practice 4 or 5 times, once you draw this diagram and practice, you will know, you will be very confident. So it's to face any questions that is asked regarding the branches of brachial plexus. Okay, so it is a very easy question. Once you understand and learn this diagram, it is going to be very easy for you. Okay. The next question is Erb's point. So what is Erb's point? So a particular region in upper trunk of brachial plexus is called Erb's point. Okay. So this is the Erb's point. So what is the peculiarity of this region is that six nerves meet at this region. So what are the six nerves? C5 root, C6 root, suprascapular nerve, nerve to subclavius, anterior division of upper trunk, and posterior division of upper trunk. So all six nerves meet at the region of Erb's point. Okay. Now the third point is that injury to this region, as in birth injury or fall on shoulder, causes Erb's palsy. So when Erb's point is compressed or damaged, it gives rise to Erb's palsy. So how can this injury or this region be caused? Means as in birth injury. So during normal vaginal delivery, rarely this Erb's point is damaged. Okay. Also during fall on shoulder also this Erb's point can be damaged. Now the fourth point is that the deformity is known as policeman's tip hand or waiter's tip hand. So on looking to the patient it appears like a policeman's tip hand. Okay. So the deformity is known as policeman's tip hand or waiter's tip hand. Now on to the next question, quadrangular space. So this rectangular space that you see here is the quadrangular space. Okay. Now what is quadrangular space? So the quadrangular, see in this diagram, so I have given this diagram for making it much more simpler to you. So this green space is the quadrangular space. Okay. So the quadrangular space is an anatomical space in posterior axilla region. Okay. So it is an anatomical space in posterior axilla region and is a rectangular shaped space. Okay. It is a rectangular shaped space with four boundaries. So the boundaries are important here. So what are the boundaries? Superior. So see here, superior is formed by, what is this? Teres minor. Superior is formed by teres minor. Inferior, what is inferior formed? See here, see the what is inferior? What is this? Teres major. So this is formed by teres major. Now look the lateral. On to the lateral it is formed by, so this is the lateral space. Okay. So this is the lateral space and the lateral is formed by what? Humerus. So surgical neck. So surgical neck of humerus form the lateral border of this quadrangular space. Okay. Now on to the medial surface. What is medial surface formed by? Medial surface is formed by, see here, long head of triceps brachii. So the medial surface is formed by, medial boundary is formed by long head of triceps brachii. So you can memorize this diagram, practice this diagram. Once you practice only this diagram, with this diagram itself you can write the points which is needed for the 2-mark question. Okay. And again an important point is the contents of this. They'll ask this itself as a separate 2-mark question. What are the contents of the quadrangular space? So the contents of the quadrangular space are axillary nerve and posterior circumflex humeral vessels. What? Axillary nerve and posterior circumflex humeral vessels are the contents of quadrangular space. Okay. So the next question is wrist drop. What is wrist drop? How does this happen? Okay. So the first point, the radial nerve when commonly damaged in the region of radial groove leads to wrist drop. So how does this happen? The radial nerve, which the radial nerve passes through the radial groove. So when the radial nerve which passes through the radial groove and when injury happens at this region, it leads to wrist drop. Okay. So it is also known as what? Radial nerve palsy, also Saturday night palsy or crutch palsy. So these are the other names of this radial nerve palsy. Okay. So due to this, wrist drop is caused by this radial nerve palsy. Second point is the injury can be due to fracture of body of humerus. When there is a fracture in the body of humerus, this injury can be caused. Also it can be due to the pressure of crutch. So that is only known as crutch palsy. Okay. Then one is the sleeping in armchair with limbs hanging. So these alcoholics, when they sleep in an armchair with their limbs hanging outside, it causes what? The Saturday night palsy, which is also the radial nerve palsy. Okay. So what does this cause? So what can you see as a what is the presentation in patients is that it leads to the weakness and loss of extension at wrist. Okay. So at this wrist, the patient is experience a weakness and loss of extension. The patient cannot extend. Then again, another one presentation is that they also experience a sensory loss over the back of forearm and lateral side of dorsum of hand. So these are the presentations we see in a patient. So wrist drop is due to radial nerve palsy, which can happen due to all these things: fracture of body of humerus, pressure of crutch, or sleeping in armchair with lamps hanging, and These are the presentation in patients. So these 3 points are enough for wrist drop. You can draw this diagram if you need. So okay, so that's it with the second part. I hope you all like this video. So I kindly request you to support my videos. So the videos will be coming soon. Now, again, 5 more questions are there in this short answers for upper limb. It will be coming in this part 3. So thank you everyone for listening. And all the best for your exams. Okay. Thank you, doctors. Thank you.